Thank you for joining us today. Through Stanford University's School of Medicine, Center for Asian Healthcare Research and Education, we were able to find differences while seeking gender-affirming care among LGBTQ youth within Asian American and Pacific Islanders. To begin, around 2 million people identify as transgender or gender diverse in the United States. Of this, about 1.4% are adolescents. Through the Stanford's Pediatric and Adolescent Gender Care Clinic, we hope to capture this patient population as about 27% of the Bay Area is comprised of Asian Americans. This clinic provides gender-expansive care for transgender and non-binary patients as well as their families, and they treat about 2% of the national average of AAPI patients. Our study aims to investigate key variables such as age of gender identity presentation, age of first visit to the clinic, as well as the intersection within mental health when seeking gender-affirming care.
To begin this study, we analyzed patient charts from the electronic health record, EPIC, where we looked at variables that are of interest to the patient population, such as age of coming out and mental health characteristics. We took the patient data that we obtained from EPIC and imported it onto REDCap, a survey database tool, where we would be able to analyze our data through logistic regression model and compare our outcomes. The patient charts that we analyzed were from September 2020 to August 2021, and the racial groups of interest are non-Hispanic whites, Black or African American, American Indian or Alaskan Native, Asian, Native Hawaiian, and Middle Eastern. Our variables of interest include demographic, gender, identity, and mental health variables. These would include trans male, trans female, non-binary questioning for our gender identity variables. For demographic, age, race, and religion. Mental health variables would include the health of the patients, the family structure, and the social support.
So far, we've completed 173 out of our database of 705 cases. After all the data is collected, we hope to perform comparisons between racial groups and our LGBTQ characteristics, such as age of coming out, age of presentation, mental health characteristics, and so on. In review, this study asks what impacts the patient's pathway to seeking a gender-affirming care. And we hope our results highlight the need to focus on understanding the concerns of underrepresented Asian Americans and LGBTQ population. And therefore, through this compelling and complex and novel research, you want to do a deeper analysis to capture the struggles and strengths of our population interests in order to have a larger impact within the LGBTQ community. Thanks.